So now I'm going to talk about the ventrogluteal IM, or intramuscular injection site. And I'm going to actually use the gluteus injection simulator and my skeleton to demonstrate how to landmark anatomically. And then in another video, I'm going to actually show the injection. Just to let you know, ventrogluteal is the preferred site for most IM injections, especially for adults and children of any age, even those who don't walk. And it is because statistically there is less probability of risk for injury when we use this site. It's very large and it's very deep, and it is away from major nerves and blood vessels. So it's important to note that this is the preferred site for injections of large amounts of fluid. So anything over 1 ml to 3 ml of fluid should be injected, preferably in the ventrogluteal site. So this actually can be administered if the patient is lying on his or her side or back, and I prefer the side. Just to demonstrate with this simulator, this is a buttocks simulator, and just to let you know what the concern is this sciatic nerve that runs on either side of the gluteus. And what's most important is that when we're injecting, we're landmarking so that we avoid hitting that sciatic nerve, because that can cause very, very serious painful circumstances afterward and permanent damage if this sciatic nerve is hit in injection. So I'll just demonstrate for you using my friend Al, the skeleton. I'm going to demonstrate how you landmark, and then I will landmark on the mannequin. So first thing to do is place your heel of your hand on the patient's right trochanter, the hip of that patient. So when they're on their side, it's that hip bone that protrudes, and that's where lying on the side can really help. What's important is if you are on the patient's left side, as I am with Al, you would locate that and put the heel of your hand, of your right hand, on that greater trochanter. So you're putting your hand there, and your thumb should be toward the client's groin. Then you're feeling, palpating for this iliac crest. And you want your finger, your index finger, to go straight up, point straight up toward your client's head, and then move your middle finger as far to the right as you can. And what you'll see is between this index finger and this middle finger and the top of this iliac crest is you have a triangle. And that is where you want to inject, in the center of that triangle. So now I'm going to demonstrate an IM injection into Shirley's ventrogluteal site, her left side. So I've asked Shirley already to turn onto her side, and I'm going to actually expose her buttocks. Notice that Shirley's knees are bent as well. That actually will allow it easier access to the site. So to landmark again, I'm putting the heel of my right hand on Shirley's hip, and I'm actually pointing my thumb toward her groin and my index finger pointing upward to her head. Then I'm going to find the iliac crest, and I'm going to extend my middle finger as far backward as I can along the iliac crest until I find I have my triangle shape between the index and middle finger and the ridge of the iliac crest. And it is there that I'm going to inject. So I place my alcohol swab there. And again, I have a 1.5 inch needle for Shirley because this is a deep, large muscle. So I've wiped with my alcohol, and I placed my alcohol swab just above it. Let the air dry that area. Pull my skin taut with my Z tracking, and then I would go straight in. Let the area dry, bevel down, go straight in, pull back on the plunger, watch for aspirate, and then this is 1 mil, so we count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and remove.